Hello everyone, I'm Dr. Mansoor, and today we're going to talk about something that's rare but extremely serious: botulism. Now, I know botulism isn't something we hear about every day, but it's important to understand because it can be life threatening if not treated quickly. So, let's dive into what botulism is, how it happens, and most importantly, how you can stay safe. Botulism is caused by a toxin produced by the bacterium Clostridium botulinum. This toxin attacks the body's nerves and can lead to muscle paralysis, difficulty breathing, and even death if not treated promptly. It's one of the most dangerous toxins known to science. There are several types of botulism. Foodborne botulism. This happens when you eat food contaminated with the toxin. It's often linked to improperly canned or preserved foods. Wound botulism. This occurs when the bacteria infects a wound and produces toxins inside your body. Infant botulism. This affects babies under 12 months old when they ingest spores of the bacteria that grow in their intestines. Iatrogenic botulism. This rare type occurs when too much botulinum toxin is injected for medical or cosmetic reasons. So how do you know if someone might have botulism? Symptoms usually start within 12 to 36 hours after exposure, but can take up to several days. Some common symptoms include difficulty swallowing or speaking, dry mouth, drooping eyelids, blurred or double vision, muscle weakness, paralysis that starts in the face and spreads downwards, difficulty breathing. If you or someone you know experiences these symptoms after eating canned or preserved foods or after an injury, seek medical attention immediately. Botulism is a medical emergency. Now let's talk about how you can prevent botulism. The good news is that it's entirely preventable if you follow some simple safety steps. Follow proper canning procedures. If you're canning food at home, always use a pressure canner for low acid foods like vegetables, meats, and fish. Make sure your jars are sterilized and follow tested recipes closely. Boil home canned foods before eating. Even if your food looks fine, boil home canned food for at least 10 minutes before eating them. This kills any toxins that might be present. Refrigerate perishable foods promptly. Keep perishable foods below 40 degrees Fahrenheit or 4 degrees Celsius or above 140 degrees Fahrenheit or 60 degrees Celsius to prevent bacterial growth. Check food containers. Always inspect your canned goods, whether homemade or store-bought. If a can is bulging, leaking, or has an unusual smell, throw it out immediately. Keep oils infused with garlic or herbs refrigerated. Store oils infused with garlic or herbs in the fridge and use them within 4 days. Don't taste food from damaged cans. Never taste food from cans that are swollen, leaking, or damaged. Even a tiny taste can be deadly. Don't give honey to infants under 12 months old. Honey can contain Clostridium botulinum spores that could cause infant botulism. Avoid giving honey to babies under 1 year old. Don't leave cooked potatoes wrapped in foil at room temperature. Potatoes wrapped in foil create an environment where the bacteria can thrive if left at room temperature for too long. Keep them hot until served or refrigerate them within 2 hours. Avoid homemade alcohol. Pruno. Some people make homemade alcohol in unsafe conditions. This is risky because it can harbor botulinum toxin. If you suspect someone has botulism, whether from food poisoning or a wound infection, it's critical that they get medical help right away. Call emergency services immediately. Botulism requires urgent treatment with an antitoxin that stops the toxin from causing further damage. Do not wait for symptoms to worsen. Time is of the essence with botulism because it can progress quickly and lead to respiratory failure. Botulism may be rare, but is incredibly dangerous and is preventable. By following safe food, handling practices, and being aware of potential risks, you can protect yourself and your family from this deadly illness. Remember, always follow proper canning procedures, refrigerate perishable foods promptly, and never taste food from damaged containers. And if you're ever in doubt, throw it out. Your health is worth more than risking a taste of spoiled food. If you found this information helpful, and I hope you did, please hit that like button and subscribe for more health tips from me. Stay safe out there, and remember, when it comes to food safety, prevention is everything.